just to give some sort of foundational knowledge as to why muscle is so important, because some people still might not be aware of the link between longevity and muscle. A lot of this is to do with, from what I understand, glucose.
So it has to do with muscle is the sink for glucose. It is a key factor in preventing insulin resistance, not to mention strength, staying upright, not falling down, causing a fracture, right? So muscle is a metabolic endocrine organ. It releases, when it releases, one of the things it releases is skeletal muscle contraction, biceps curls, causes the transcription of a protein called klotho, which is the longevity protein. About 30 years ago, it was described in Nature. It is the protein when muscle contracts that's transcribed. It works on every organ. We know that it's critical for the longevity and repair of organs because mice who are born without the ability to make klotho die old, very young. Chronologically, they're very young mice, but they die very old mice because they have not enjoyed this protein klotho. We make klotho by the contraction of skeletal muscle. Here's a study I did years ago that showed that I measured klotho level circulating in the blood of older masters athletes, people 60, 70, 80, younger masters athletes, 40, and sedentary people. And what I found that the highest levels of circulating klotho, the longevity protein, were in young athletes, not surprising. The second highest level of longevity protein klotho were in old masters athletes, 70, 80. The lowest level of longevity protein were in young sedentary people. So even old athletes had more circulating klotho than young sedentary people. So just the contraction of skeletal muscle can add to your longevity through this protein. Another protein that's released with skeletal muscle contraction called galanin, it is transcribed, goes to the brain, works at a place called the nucleus ceruleus, which is critical for resilience. It makes you more resilient. It helps you able to problem solve. And then, a very popular protein that is transcribed with skeletal muscle contraction is called irisin. It's the exercise protein, which, it works on bone. It works on fat to brown fat, from white fat to brown fat, which has higher thermogenesis. It has higher mitochondrial load. So muscle, just in doing its thing, not just looking pretty in a gym mirror, does all these metabolic functions. And so that's why we think it has such a key role in longevity.
So if I'm trying to protect my muscle as I age, are there any supplements that I should be taking? I mean, do they sell klotho supplements?
They don't. You have to make it.
Oh, fuck.
Contract your own muscles. Well, you need to feed your muscles. I always quote people 1 gram per ideal pound. Because listen, I'm an actual practicing person, doctor. And here's what I know. People need really specific instructions and they can't be confusing. So is there a range of protein people need? Yes, there is. But people can remember 1 gram per ideal pound. So you got to feed your muscle with protein. High quality protein. The highest quality protein has the greatest percentage of an essential amino acid called leucine. Leucine is not made by the body. It has to be taken in from the outside. It's a branched-chain amino acid, and you get it from whey protein. The best source in the universe of leucine and whey protein is mother's milk, but most of us don't drink that as adults, so we get it from dairy products. You can get it from plants. For everybody that is a plant lover, you just have a much lower percentage. You have to eat a lot more of it. So high-quality protein, number 1. Number 2, there's a lot of research for creatine supplementation for both men and women. When I first started being aware of creatine in 1992, it was during the Olympics. I was working with a bunch of wrestlers at that time. We would give very, very high doses. We would cycle the creatine. We would come on and off. Now, steadily, 5 grams a day will help build muscle. It will help build brain.
It's really interesting. A couple of months ago, I asked the people in my office if they used creatine.
Yeah.
And a couple of the guys put their hands up. None of the women put their hands up.
Huh.
And I asked them why. I said, why don't you use creatine? They said, that they thought it was for bodybuilders?
Well, it started out for bodybuilders, but it's for everyone. Actually, it's very well studied. So
I actually had this debate with my girlfriend last year at Christmas time because I was taking creatine and asked if she wanted some. And she made the same comment to me that it was for bodybuilders and that
Yeah.
she'd put on weight if she had it. And then I said, no, that's not true. So she Googled it and she saw that it's good for like cognitive performance,
Yes.
skin, hair, muscle, bone, etc., etc. And now she takes it every day.
Perfect.